Alright, so this is a posterior aspect of the model of the leg or the model of the lower limb. You can see that this is the heel, right, and then the posterior compartment of the leg, and this is the posterior compartment of the thigh. Alright, now here you can see in the posterior compartment, in the posterior aspect, just behind the knee joint, you can see the popliteal fossa. Now when we talk about the boundaries of the popliteal fossa, these are the superior boundaries. You have, again, this is the medial side. If you follow it here, you can see that this is the big toe, right? So this is the medial side, this is the supramedial, and these are the this is the inframedial boundary. This is the supralateral boundary, and this is the infralateral boundary, right? So on the medial side, superiorly, we have the two, the semimembranosus and the semitendinosus, right? So the one on top here is the semitendinosus, and this gets inserted into the pes censorinus on the anterior aspect of the tibia. So you can see the sartorius, the gracilis, and the semitendinosus. Now deep to the semitendinosus, we have the semimembranosus, and the semimembranosus is in fact the muscle that forms the supramedial boundary of the popliteal fossa. On the lateral aspect, you can see this is the biceps femoris. Here you can see they have a common insertion, and all of these come from the ischial tuberosity. So this one here is the biceps femoris, and this forms the supralateral boundary of the popliteal fossa, and this gets inserted onto the lateral aspect of the head of the fibula. Alright, now coming on to the inferior aspect, here we have the two heads of the gastrocnemius muscle. This one is the medial head, and this is the lateral head, and these two form the two inferior boundaries of the popliteal fossa. Alright, now let's remove these muscles. So we've removed the biceps femoris, the semimembranosus and semitendinosus. This one is the biceps femoris, we've removed that as well. And inferiorly, we remove the two heads of the gastrocnemius. Now this gives us a clear view of the popliteal fossa. Here you can see this is the popliteal artery. Now the popliteal artery gives its genicular branches in the popliteal fossa. So you can see the superior medial genicular artery, the superior lateral genicular artery, the inferior medial genicular artery, and the inferior lateral genicular artery. This is the sciatic nerve. We've done this part of the sciatic nerve before, how it emerges from the greater sciatic foramen and then moves into the posterior compartment of the thigh. So here it moves in the posterior compartment, and at the apex of the popliteal fossa, which will be here, it divides into its tibial and its common peroneal branches. Now the tibial nerve here goes straight down in the center of the popliteal fossa, and then it supplies the posterior compartment of the leg. This is the common peroneal branch of the sciatic nerve. Now this travels along the medial margin of the biceps femoris, and here you can see the the short head of the biceps femoris. Now the common peroneal travels along the medial margin of the biceps femoris and then gets deep and winds itself around the neck of the fibula. Here you can see the popliteal vein in blue, right? And when it comes to the relationship of these three structures, the artery is the deepest, then comes the vein, and then comes the tibial nerve. After that, this muscle here, deep to these neurovascular structures, the diagonal muscle with its oblique fibers, this is the popliteus muscle, which is responsible for unlocking of the knee. So this here is the popliteus.